Welcome back, everyone. Glad you're here. We're going to talk about why a triglyceride level above 250 should make you worry and what to do about it. I'm Theresa Garnero.
And I'm Stephanie Bouquet, and we are both diabetes educators. I'm a registered dietitian, and Theresa is a registered nurse.
That's right. So double trouble. We're going to talk about your liver today. So the liver is your body's largest solid organ. On average, it's like around 3 pounds or so, and it's roughly the size as a football. But it's really vital to your body. It detoxifies. It does a lot of things for your immune system. And basically, without a liver, you really can't live. So it puts the live is in liver, because without it, you can't.
Yep. Yeah. And this is just kind of the list that you put here. I mean, there's many, many more functions too. So you're right. Without your liver, we won't be living.
That's right. And all of the blood that passes through the stomach and intestines goes through the liver. And it's for that reason that some people think of the liver like a chemical processing plant or an inspection station, because everything goes through it. It processes the blood and breaks down nutrients and chemicals. It does all kinds of things. There are some like 300 functions, and I barely know a handful. I just know it's really important, and it's super important with diabetes, which we're going to talk about here in a moment. Yeah, it clears blood of drugs and other poisonous systems, and it stores extra glucose in the form of what's called glycogen. It also helps to produce cholesterol and special proteins that carry fat through the body. So what could go wrong with this?
Everything.
Yeah. So what happens when your liver isn't happy? If you have type 2 diabetes or have overweight or too much cholesterol, then the fat builds up in your liver, and that is known as non-alcoholic fatty liver disease, or NAFLD. That's the acronym. And this is an image of kind of like what a healthy liver looks like and what a fatty liver looks like. It's starting to get fat deposits and not look so healthy. And here are the stages. So this can be progressive. And if it goes from a fatty liver, may have been told, oh, you've got a fatty liver, but that excess fat can actually cause damage and inflammation and lead to what's called liver fibrosis. It's sort of like, think of it like it's scarred, if you will. Right. Some scars start to develop. And this is called non-alcoholic, I can never pronounce this, Stephanie.
Steatohepatitis.
I just call it NASH. I think of
it's much easier.
Yeah, that's right. So if you have NASH, you already have some cell damage. Okay. And you can still take action here. If it gets to the part where the liver is so scarred that it really stops working as it should be, we call that cirrhosis. And yeah, the scars actually replace healthy tissue, and that's not good, because your liver can actually fail. And in this stage, people also can get liver cancer. So you might think, fatty liver, so my liver's fatty. What's the big deal? Well, the big deal is it can lead to liver cancer, and it can lead to high blood sugars too. So how do we know about this? One of the ways, I kind of gave this slide away, from healthy to rest in peace. We don't want this. So we want to avoid the cirrhosis stage. And you start by knowing what your triglycerides are. And I knew my initials TG was going to destine me to this kind of work, because triglycerides initials are TG, just like my initials. But if you have a triglyceride level above 250, that is an indication of a fatty liver. That is all you need to remember about this lecture. If you've got a a TG, a triglyceride of 250, that means your liver is starting or it has the fatty liver condition. How do you know this? Stephanie, how would they know?
Well, that's actually to actually test your triglycerides, you would need a blood test for that.
Mm-hmm.
But I just wanted to kind of add to your point where you said, if you don't remember anything about this lecture, just remember this number, 250 fatty liver.
Mm-hmm.
Also remember, fatty liver is really the point where we can reverse the damage. Once you get to the point of the liver fibrosis, which is the next stage down, you're still going to be stuck with some of those that scar tissue. So
Mm-hmm.
your liver's not going to be 100% functioning the same again. But if we can start at that stage of fatty liver, this is where dietary intervention can make a huge difference, and lifestyle, exercise, that type of thing. So just to kind of,
Well said.
clue into that. If you
That's
told you have
right.
fatty liver, it's a big deal, and we need to help you make some changes.
And, I think back on my career, Stephanie, and, people would have a fatty liver. We would not sound the alarm bells. I think just
No.
now it's starting to happen. Maybe for the dietitians, that's always been there. But I haven't picked up the sense of urgency. It's not like, oh, it's in the standards of care. To the point where, we talk about A1C, but
Right.
I don't think we are as vigilant with really addressing a triglyceride that's above 250 as we are an A1C that's above 7,
I absolutely agree. And I still don't think we're at that point where it's, super, people feel like, oh, wow, I have fatty liver, man, I need to do something. So that's
Mm-hmm.
why I'm hoping everyone, that'll be the take home message. Yes, you need to do something. Don't let
Right.
it go.
That's
Mhm.
right. So what can you do? Well, stopping the progression, and there are a number of things that Stephanie mentioned about, what you eat and being regularly active. If you are carrying extra weight, through losing some of that weight, reducing weight, that surplus fat that's in the liver causing inflammation will start to lessen as well.
And what's interesting about that, when we think about losing weight, we think, oh, okay, well, I'll lose weight. And we do lose weight overall, overall, our whole entire body. But the first place that we lose weight is we reduce our organ size. So the liver will actually shrink.
That's cool.
Yeah, back to normal size. Because when you have a fatty liver, it also becomes larger.
Yes, and the thing, we're going to talk about this in an upcoming lecture about the circadian rhythm and the fed state and the fasting or the fasted state. The issue when you have a fatty liver, it's as if the liver is in a fed state. It's like, even though you're not eating, it's still having to deal with sugar. So losing that weight, as Stephanie said, it helps to get back to more of a fasting state, and it gives your liver a break. It gives it a rest,
Absolutely.
Being active regularly can also help to prevent that scarring from getting worse. Sugar is going to cause inflammation of those liver cells, and the fresh foods, eat like your grandmother did. Well, I don't know. She was from Sicily and fried a bunch of stuff, but she ate fresh,
Right. Yeah, I think the process, the convenience, the sugary drinks, those are really the huge issue with fatty liver. And that's the first thing you want to kind of take away. And the reason that the sugar is such an issue is because, like you said, everything goes through the liver. And so there's a pathway where carbohydrates or sugars will go through there to be digested and absorbed, and they can cause, again, inflammation on those cells, and that's when the fat starts to deposit into the cells. It changes how the cells work.
True. This next bullet point here on alcohol in moderation or stop it entirely is really important, because you don't want to give your liver even more things to work on. And, I know that a lot of people are not aware that drinking alcohol, even if you're drinking under the guidelines, it is a risk for cancer. That alarm bell hasn't really been, I don't know, that a lot of, I think it's like 9 out of 10 Americans in a recent survey they weren't aware that just even having a glass of wine a day could actually be a risk for cancer. So, you know, if you are thinking about stopping, it would give your liver a break and also have some other benefits as well.
Right. Because remember, alcohol is it's a toxic substance to your body. And so the liver is a detoxifier. So it's working to get that ethanol or that alcohol out. So it really makes it work, makes those cells work harder. So, yeah.
Yeah, Debbie Downer here, continuing. Medications, also you need to know what kind of medications and how they're being, because the liver is going to process them. So work with your pharmacist and ask your prescribing provider about the medications that you're taking. Should you be taking all of them? Because some of them, this is from the American Association for the Study of Liver Diseases a couple of years ago. Metformin is not recommended for treating people who have NASH. Whereas one of the drugs called a TZD, pioglitazone, it does help liver health for people with and without type 2 diabetes. There's also a group of medications, they fall under this category called GLP-1 receptor agonists, and they are being studied right now to see if it actually can help liver disease progression or stop it for people who have NAFLD or NASH. So there's a lot going on. And of course, this just really requires the communication with your provider. I mean, it makes sense about metformin because it goes to the liver and says, hey, don't put out so much sugar. But some of these other options can really help you as well. Not part of the guidelines. There's some promising research looking at help me.
Liraglutide.
Liraglutide, that's a tongue twister, and semaglutide that shows some resolution of NASH without making the fibrosis or those little
scar tissue.
Thank you, the scar tissue worse. And there's also benefit in adding semaglutide. There's an oral form or a pill form of this to like Actos as an example. So there are treatments that are available, but you know, you can do a lot with what you eat and how you exercise and how you care for your liver. And so, yeah, bottom line, ask for your results so you know what's going on, because we are so used to seeing high numbers that we might be just tunnel vision on your glucose or what's going on with your blood pressure and say, oh yeah, the triglycerides are, you know, 800, we'll deal with those later, you know. So ask for a copy of your labs, and so you know what your triglyceride level is. Get it done once a year. Have that conversation with your provider. Rope in the pharmacist. They're so smart with a lot of these medications, so that you know what you're dealing with. And if your liver is in good health, it's really going to help your overall glycemic or glucose management. Yeah, I feel like I've just been a little preachy here.
No, I mean, I think bottom line, what you can do is be proactive.
Yeah.
Get your numbers done, talk with your doctor, change your lifestyle. Look at what you're eating dietarily. If there's a lot of sweets and refined carbohydrates, chips, you know, those types of things, try to remove them or reduce them in your diet. Coffee, drinks, kind of get those out. Get moving, you know, all those things are great for your blood sugar, but they're also great for your liver. So
yes, thank you. We hope this was helpful. You know, if we can spare one of you from winding up with your liver all scarred up, then this is worth it. So appreciate your attention.
thank you.